The Mayo Clinic Care Network is a way in which Mayo Clinic can have a structured relationship with like-minded organizations. So as we look at the changes in healthcare, this gives us broader and deeper relationships with other organizations and allows us to extend knowledge and expertise from the Mayo Clinic. So in the end, it benefits patients. The benefits to the organization from the Mayo Clinic Care Network would be a number of clinical tools that are extended, and these keep changing. Right now they include electronic consults that are done in an asynchronous or store and forward fashion, access to Mayo Clinic's repository of clinical information called Ask Mayo Expert. All of these are tools that we use internal to Mayo. The third is access to best practices, if you would. We call it healthcare consulting, but it's really an exchange of best practice and preventing others from recreating the wheel when they're facing a new challenge in healthcare. And then there's a visible connection to Mayo Clinic. The Mayo Clinic Care Network benefits patients by having access to the whole staff at the Mayo Clinic. Because this is integrated into our practice, if a provider, if a physician at a Mayo Clinic Care Network site has a patient where either he or she are unsure of what to do next, perhaps it's some very unusual case, or if the patient is asking for input, another opinion if you will, it allows them to access Mayo Clinic and essentially get that opinion from any one of our 3,700 physicians and scientists, but it would be triaged to the most appropriate subspecialist. And also, it benefits patients because the clinicians can access Ask Mayo Expert at any time for really point-of-care resource information to help with the care of that patient on the spot. Mayo Clinic Care Network is looking for other organizations that are like-minded, culturally similar, but the bottom line is organizations that are patient-centric and deliver quality care. The overall goal of Mayo Clinic Care Network is we establish these strong relationships with regional healthcare organizations, is that by having the relationship and extending Mayo Clinic knowledge and expertise in a variety of ways, the goal is for patients to get the best care at the right place, at the right time with the right physician. So it's a lot about what's best for the patient again, but it's also about resource utilization. If a specialist at one organization needs help from a specialist or subspecialist at the Mayo Clinic, we can provide that remotely. And if the patient doesn't indeed need to be seen on a campus where additional quaternary care can be provided, Mayo Clinic would love to be top of mind for that. But if the patient can then get the information they need remotely, then they can stay at home. They don't have to travel. And resources aren't utilized on either end that aren't necessary. So it's really about right patient, right time, right use of resources. The way the Mayo Clinic Care Network is structured, anytime the Mayo Clinic or any other healthcare organization provides any services under a broad federal legislation called Star Clause, things have to be provided at fair market value. So the way we've structured this is as a subscription. So the subscription is based on the size of the organization, the number of physicians engaged in using these tools, etc. And then the subscription is renewable every year. Our goal is to have long-standing members in the network, but it's structured so that every year this can be reevaluated. I'm frequently asked, how big should the Care Network be, or what are how many organizations do you want in the Care Network? I don't have an answer for that. I have neither a minimum or a maximum. Our goal is to be providing value to these organizations. We would ideally like to have a national footprint, and we're also looking at international sites as well. But we will take this at a step at a time. We will take some deliberate pauses as we build the network, again, to make sure we're delivering value and quality to the organizations that are already part of the Mayo Clinic Care Network. As we anticipate how healthcare is going to change, and a lot of different things could happen, but we know it's happening, and it's happening rapidly, There's a rush to consolidation in the United States. Mayo Clinic has looked at their options and considered, should we stay just like we are today, being referral campuses and remain the best at delivering top of the care pyramid care for quaternary patients? Should we acquire broadly, like a number of people are doing, or should we look for a different type of relationship? After a lot of consideration, we decided on the latter. We do think we need to extend our reach and be able to relate to people elsewhere with a number of electronic tools that are now readily available. Doing mass acquisition takes a lot of time, a lot of resources, a lot of dollars, a lot of capital. So we think by setting up the network and having non-owned but structured relationships, it allows us to develop a strong relationship with other quality organizations. It allows them to stay independent, strong, and healthy, but at the same time have access to really a significant breadth and depth of Mayo Clinic experience.